Welcome once again to the BizLife Podcast. We're excited to be broadcasting live from our downtown Las Vegas studios at the lovely Latin Chamber of Commerce. And thank you, Carlos, for joining us here today.
Thank you, Mike. Thank you for having me. Thank you so much.
Wonderful. The Latin Chamber has been such a great partner in this podcast, and we're grateful to have you guys and all your support here. And today we're joined with Andy, and Andy is from Archwell Health.
Oh, wow.
Right?
That's great. Yes, also known as Archwell Health.
Also known as Archwell Health. Okay, I like the ultra in there. That's good. That's good. So we're excited to have you here with us today. My name is Mike Bindrup. I'm with the Small Business Education Program, University of Nevada, Reno Extension, and we're happy to be here with the BizLife Podcast. So why don't you introduce yourselves to us, Andy, and tell us what you do and how you do, and tell us about Archwell.
Like you said, my name is Andy Castro. I work with Archwell Health here in Las Vegas, where we have 5 different locations, and we provide primary care for seniors 60 and over with Medicare.
Okay. What is primary care?
What's
the definition of that?
The primary care physicians is the doctor who is actually the quarterback of all your care. The main doctor that you always choose when you do have a health insurance, you have to pick a doctor that you want to go to that will coordinate all of your different care.
Okay. Awesome.
I like the term quarterback. Yes. You
That's
can
what we
go to Davis Funeral Services, or you can be healthy.
There you go. There you go.
You go to the doctor or the mortuary.
Yeah.
Okay.
At Archwell, we try to keep you on the doctor's side.
Good. And there's a few things in between, Carlos. You don't. It's not just one or the other. We gotta be optimistic.
And Andy, for our audience, Medicare. What is the difference between Medicare and Medicaid?
Very good question. Medicare is a federally funded program. Okay, it's for the entire country. Medicaid is what the states provide, where Medicare doesn't provide. So it covers the things that Medicare doesn't, and that's every state is a little bit different.
Perfect.
Okay. I know a lot of times kids can get on Medicaid.
Yes.
Right, and so there's probably no age limit. Is that correct?
Medicaid, there is no age limit. It's also for people who become disabled, things like that, lower income. Yes, it all depends. I know that Medicaid, I believe, in Nevada this year is about $1,400 a month. If you're below that, you would qualify.
Nice. Wow. Okay. And Medicare, obviously, there are age limits to Medicare.
Yes, Medicare, unless disability, of course.
Okay.
That you do qualify. Otherwise, it's 65 years old.
Okay.
And over. Yeah.
Nice. Okay. How does that work with your insurance? Let's say I have a primary care provider. I'm over 65. Do you automatically get signed up for Medicare, or do you have to sign up?
No, for Medicare, you normally, if you have all the credits that you need to have in order to qualify, you do get Part A automatically. Part A, let me explain a little bit about A, B, C, and D so people could understand.
Okay, so there's A, B, C, and D.
Yeah, there's 4 different parts. Part A is for doctors, and that covers 80-20. The government pays 80%, and the person pays 20%. So if you go to the hospital, the least you're going to spend at a hospital is about $10,000. $8,000 the government pays. You pay $2,000.
Okay.
Part B is now different. Part B is for outpatient, which means it's for doctor's office, when you go see the doctor, when you go see things like that. So Part A, again, was for hospitals. Hospitals. Part B is for the doctors.
For the doctors, okay.
Oh, yeah. So when you go see the doctor for Part B, if you go, the visit's $100.
Is it still 80-20?
Yeah.
Okay.
Doctors, the x-rays, the blood work, all the different things add up. Government pays 80, you pay 20%.
So if I am over 65, I do have my own insurance that I pay out of pocket for, let's say. Does Medicare kick in for what is still owed at the end of the month?
Well, here's let me explain exactly how that works.
Okay.
That Part B has a cost to it, and that's the part you have to sign up for. Now, if you're still working, you do not have to sign up for it.
Okay.
But if you're not working, that's where you sign up, and it costs $164.90 a month. Okay?
It's not bad at all.
Not bad at all. Then you have Part C. Okay, Part C is basically, I like to say it's where you have a choice. So we're going to come back to Part C here in a second.
Okay.
Part D is for prescription drugs.
I've heard about this one.
Yes.
Yeah.
Everyone, when you turn 65, you have to sign up with a Part D plan unless you have insurance through work. And if you don't, you could be penalized for not doing it right away.
Interesting. Okay. And is there a cost to that one?
Yes, there is a cost to that.
Okay.
Okay. Now, that's depending on what you do with your choice in Part C. Part C, there's two choices. There's what's called the supplement plan. The supplement plan, what that does is it covers everything A and B doesn't. Now, if you cover those at 100%, you're going to pay about $175 to $225 a month on top of the $164.90.
Gotcha.
Okay. People do like these plans because they travel with you all over the country. Anywhere that takes Medicare will also take this plan. Most places will take this plan. Supplements do not give you vision, dental, hearing, and a bunch of different things that you hear in a lot of these commercials that you watch. Then you have the second choice in Part C. The second choice is what's called an MAPD plan, a Medicare Advantage Prescription Drug Plan.
I've heard of that one too.
Okay. Those plans, here's how it works. The government says, here's the $164.90. I'm going to go to the private sector, and I'm going to say, hey, Humana, UHC, Aetna, will give you the $164.90. You administer the plan. So now you get one card and from whatever company you choose, and they take care of the whole thing. So good news for the consumer is that these companies now are going, they're wanting your business.
Yeah.
So they're going to offer you better benefits. One can offer you $3,000 in dental. If you see that you don't need dental as much, we'll give you $500 in vision. They'll give you membership, gym memberships. They'll give you, and rides to and from the doctor, all sorts of things. So that's a good time to sit with your broker and talk to them and say, okay, it's time for me to make a choice. What do you recommend?
Okay.
And they go through it. Now, those plans, like I said, they come with dental, everything else, whereas the other plans, the supplementals, don't.
They don't. Okay. This is a lot of options. I didn't think there was this many options available.
No, but also my concern is this. For instance, you are retired. You are retired, and let's say average Social Security check, that will be $1,000. I don't think there are many, $1,600. But let's say $1,000. But you need to pay $165 plus $200 and something, so you ended up paying $400 almost a month.
That's why those MAPD plans, and the beautiful part about those is that $164.90 that you pay, those MAPD plans, they don't cost anything.
Really? Okay.
They don't cost anything.
That's one saving. Yeah.
That's
There
awesome.
you go. You're
Yeah,
saving a
it's
lot of money.
Okay.
And that's the biggest difference between the supplement and the other and the MAPD plans. You get much more benefits, but you also it doesn't cost you anything.
So is it better to stay on private, and if you're working, let's say you're working and you are 65, is it better to stay on a private insurance plan and then add a supplemental? What do you recommend?
That's a great question. This is what I do when someone comes into me and they ask me that exact question. I see how much they're paying right now. And if it's over the $164.90, then it's a no-brainer. You should go on Medicare.
You should go on Medicare.
Because the plans are much better. The Medicare plans are much better than the plans you get in the private sector when it comes to business.
Even if you're working and the business is taking care of a portion of it. Okay.
Now, yeah, but as long as your portion is more than that 165.
165. That's the magic number is 165.
165 is the magic number.
So for small business owners listening, if you're over 65 and maybe you have an insurance plan at the office, you're taking care of yourself and a few employees, if your out of pocket is for your premiums is over 165, it would behoove you to be on Medicare instead.
Oh, yes. Not only that, but if you're a business owner and you have people that you're paying for health care that are over 65,
it's costing you money.
It's costing you money.
Wow.
And so it would really behoove you to go to them and say, hey, you know what? Why don't we look at these other plans and look at that $164.90 instead of us having to pay $700-800 a month. Now it's $164.90, and we'll help you with that.
Are all insurance? So let's say they have some other insurance. You're with Archwell, right? Archwell obviously does this. Does every company handle Medicare? Do they know all these rules typically?
Every company has the opportunity to.
Okay.
But let me make one correction. One thing about Archwell is we're a facility with doctors.
Okay.
We're not an insurance.
Gotcha.
We're more a facility that once they get their card and they get a Humana,
you're a provider.
A provider.
Primary care
Primary
services.
care provider. Yeah, that's what we do at Archwell. But with the other things, yes, Medicare is available for all business owners, for everybody that's 65 and over. So that's something I would recommend to somebody.
Interesting.
Yeah.
Well, and I think it behooves everybody to do a kind of a checkup yearly anyway.
Yes, it does.
You should sit down with your insurance agent every year to make sure that you've got your bases covered.
And let me tell you something that we at Archwell we do, and we strongly suggest that everybody does the same thing. A lot of these plans, the Humana plans, the UHC plan, the Aetna plan, they actually pay you to go do your annual mammogram, to do your annual checkup. If you go do your annual checkup, they'll give you $50 in a rewards card.
Nice.
To go to, yes, because this, for the insurance companies, they want you to go because they want to make sure that they keep you out of the hospitals.
Yeah.
And that's what they
I don't know if they do that at the university. To be honest, I'm like, I don't think so. But, I haven't gotten any gift cards or anything. We love gift cards, right, Carlos?
Oh, yeah, especially women.
Yeah, it's perfect. Perfect.
I will ask to see if I can give you guys gift cards, but I'm not making any promises.
As long as it's untraceable, we're all good, right, Carlos?
Yes, no,
that's the word. Yeah.
I'll tell you this much: if I can't work for Archwell anymore, I'm going to have to come work for you guys.
Yeah, there you go. Come on over. This is good stuff. Now, I've heard people talk about do you handle other types of insurance besides Medicaid and Medicare?
At Archwell, no.
Okay,
all they do
do
is
that.
just Medicare, Medicaid, and they have to be in one of those MAPD plans.
Gotcha. Okay.
And we're opening up, since we're new here, we've opened up, there's 4 companies right now, and that is Humana, United Healthcare, Aetna, and right now we just announced Anthem.
And Anthem, okay.
So those are the 4 that we take now here. And that's why it's so important to us. One of the things people don't realize is in this county, it's 2,500 to 3,000 patients per doctor.
Wow.
At Archwell, we don't do that. See, at Archwell,
that's a lot of patients.
We do what's called value-based care.
Okay.
As opposed to fee-based care. Let me explain the difference. Fee-based care, you go see the doctor, and the doctor's got to see about 15 to 20 patients a day to keep the doors open.
Mm.
Okay? They're paid by each person that comes in, they get paid. Value-based care, which is what we do at Archwell, and the reason I joined Archwell, they get paid by the diagnosis. So what does that mean to the patient? It means that the doctor's going to spend time with you, and they're going to ask you all sorts of questions
To make sure they get it right.
Make sure they get it right. Your first appointment with Archwell Health is going to be about 40 minutes to an hour, and it's with the doctor. You're going to meet the MAs, you're going to meet the PAs, but you will see a doctor.
Yeah.
And so they, instead of seeing 10 people, if they get one person and they have headaches and they have, all the different diagnoses they come up with, that's how they get paid. It's crazy how doctors don't even know this. I saw my cardiologist about 3 weeks ago, and he goes, "Andy, you wouldn't believe this." I go, "What's that?" And he goes, "When I go and I write my notes, depending on how I write my notes, this is how much they pay me." And I'm going, well, no, that's not what they're doing. What they're doing is these Humana and these plans, these MAPD plans, are turning into value-based care, which means the more diagnosis that you find, the more that you get paid for.
Interesting.
And so now the doctor, instead of seeing what we do, we fill our panels at 450 to 500 patients, and that's it. Then we have another doctor, and then we hire another doctor. And we pride ourselves in same-day appointments. Some of the things that we've talked about before, that's how we grew up, right? We weren't feeling good. You call the doctor.
You call the doctor, you'll go in.
Exactly.
The doctor you know.
The doctor that you know, exactly. That's what we pride ourselves here at Archwell is you need a same day. We have a triage there. Now, if you're going to call us, you're going to say, "Hey, my heart's going. I don't know what's going on." We're going to say, "Call 911."
Yeah.
But if you're coming in and saying, "Hey, you know what? I'm having breathing issues. Hey, we have a triage. Come on in today. We'll go ahead and we'll see you today." So we're trying to make healthcare revamp healthcare
That's a
here in the Valley.
Great feature. Yeah.
And what about if my wife make me cry? So what I need to do?
You suck it up, man. Suck it up, Buttercup.
Yeah. We don't do marriage counseling.
Okay.
You can call me anytime.
There's some
I'll
psychological
talk
help.
about
Yeah. Is there psych evaluations available? Yeah.
We could refer it out.
Okay.
Yes.
See,
we could find you somebody.
I missed it already. I'm not qualified, man.
Yeah, we always recommend you have a therapist, Carlos.
Yeah.
or a bartender. One of the two.
I prefer the bartender.
You prefer the bartender.
I go plan B.
Yeah, that's plan F is the bartender. Yeah.
Yeah, bartender, plan B.
Oh man. Well, in our healthcare system in the United States, it's gotten to the point where, back in the 70s, we didn't really have insurance companies, right? We had doctors, and it got to the point where the fees kept getting out of control, and that launched the insurance industry, right, which regulated things. And people can argue for or against it, but yeah, it's so we pool together, liability essentially, and that makes it more affordable to deliver services and things like that.
And that's a great point to bring up, because back 10, 15 years ago, even 8, 10 years ago, when you would say the words HMO, you'd be going,
PPO,
oh no, I want a PPO, I don't want HMO.
Yeah.
Things have gotten very different now.
Way different.
Way different. Where an HMO plan and a PPO plan, a lot of them cover about the same thing, and you're giving up a lot of great benefits in an HMO plan that you don't get with a PPO plan. And if your doctor's in the network, what's the difference? Yeah. And to me now, so many doctors are, like you said, before it was independent, then they started this managed healthcare. Well, now the managed healthcare has gotten so big that a lot of doctors are apart. And so make sure that you check that and meet with your broker to make sure that they could guide you the right way.
Absolutely. And we had an issue. My son has some medical concerns, and it was interesting. He wasn't diagnosed until we were living in Switzerland. Of all places, they did one blood test.
What part of Mexico?
One blood test. It's a little further north.
Chihuahua?
It's North Mexico, way
okay.
north. Yeah,
Okay.
yeah. So, but doctors, he had been sick here numerous times, and doctors had not. The philosophy is get you in, get you out. I mean,
yeah.
When you're in the hospital, you've always experienced this. The next morning, somebody shows up, and they're from the insurance company going, "Okay, were you ready to go?"
Yeah.
I was like, "I haven't seen the doctor yet," and. It's kind of like that. In Switzerland, their philosophy was, we're not letting you leave till we figure out everything that's wrong. And that was refreshing.
Isn't that different? That's the value-based care that Archwell.
And that's value-based care, which is really interesting.
Yeah, value-based care is what you want to look for.
Yeah. So, I mean, that makes you feel a little better that, hey, if there's something going on, you want to nip it in the bud.
It's because sometimes first, to understand what is Medicaid and Medicare first. Secondly, when you are into the systems, you don't know. Nobody guides you. This is your primary doctor. That's the one you will see it. But I remember, I won't mention names, but I remember I had a Japanese good doctor. Then come another Asian person and say, the doctor changed in 1 year. And then the next year I see another one. I say, come on, what is the doctor? So and so and so. Oh, he is the doctor, but the assistant is getting to you and say, no, I want the doctor I met because I like him. So that's the problem.
Well,
with
a doctor
system.
Can't see 3,000, 5,000 patients a year.
That's the problem.
You just
and
can't.
That's the problem we're having in this county. I myself had 5 surgeries in the last 6 years.
Oh, wow.
And I've been seeing the same doctor for 10 years. And I keep saying doctor, right? Mm-hmm. She's amazing. I love this doctor, and she takes care of me. When I was in the hospital, one of the times they came in and they say, your doctor's going to be coming to visit. And I'm going, great. And the day go by, different doctors would come in. I said, why doesn't my doctor come? Mm-hmm. Who's your doctor? And I told them. They said, she's not your doctor. She's your PA. Your physician
She's your physician
For
assistant.
10 years, I did not know that wasn't even my doctor.
Well, you call him doctor. If you see him, you call him doctor.
She never corrected me, but, that's okay.
Yeah.
But you know what? To me,
That's why you went to the hospital 5 times.
That's probably. That's probably what. No, she's amazing, and I wouldn't choose a doctor over her anyways.
No.
But
I think the PAs spend more time with you because they have more time to spend.
Exactly. And now with the way we're doing things with Archwell Health, and this is when they flew me out and they told me what they were doing, that's when I made the change from selling insurance to being part of the medical part of it and saying, I want my clients to come here because they're going to take care of their patients.
Yeah. Now, Andy, I got to ask a question. This is a serious question.
Let's pay attention.
What's some of the craziest inquiries that you get in the insurance business? Like, can I insure my pets? Can I do my goldfish? Can I do my guinea pigs? Can I do my?
Well, last week when Carlos called.
Oh, it's Carlos. Yeah. What did Carlos ask? Let me check.
You get people that are calling you, and I mean it's sad. they're having a heart attack. And you're telling them, what do you know? Call
911.
Call 911. The craziest story, though, that one time we were at the hospital, and hopefully I could share this. No, you guys can cut this later. Was a
We'll
person,
clip it out.
A person coming in with bad. She was a bit overweight, okay? And she was coming in with a bad pain, and she went to the restroom, and she had a baby.
She had a baby?
She had no idea she was pregnant. Yes.
Oh.
Yes.
God. Another
surprise.
money, child support.
So I'm just going to leave that one there.
Surprise.
Surprise.
Yeah, I've had some surprises in the morning. That's a big one, though.
Yeah.
Yeah.
And there's other ones that I just, if you have a show that's on
She
after midnight.
delivered a baby. She was having some pain. She was having contractions.
She went to the restroom and
literally delivered.
Yeah.
Wow.
She was in labor and didn't realize it.
Didn't realize it.
Wow.
Yeah.
Wow. Well, that's a good one.
Yeah, it's pretty good. Isn't
That's
it?
really good.
Yeah.
That's the best one I've heard today. This is pretty good. Oh my gosh. Oh my gosh. So, but I mean, probably one of the most common questions you get is what is the difference between Medicaid and Medicare, which we've talked about, right?
Yes.
So, just to review that, Medicaid's for anybody, and Medicaid's the state.
Exactly. Medicare
Medicare
is state.
is federal.
Medicare is federal.
Okay, so
And when I first started talking about parts A, B, C, and D, I just want to make sure I said it correctly. Part A is for hospitals. I said doctors, I think.
Yeah.
Was for hospitals, 80-20.
Mm-hmm.
Part B is for doctors. Part C is your choice, and Part D is prescription drugs. So I apologize for that.
Okay.
Yeah, A is hospital, and everyone gets that as long as you have your credits. You get that.
Okay.
If you don't have your credits, it could be very costly. So to make sure that's always every time you see that on your paycheck going away saying Medicare, Social Security, it's going for you're saving up for your health care.
for your health care in the future.
In the future, and these plans are amazing plans.
Okay. Good.
This is great.
That's thank you for clarifying that. Medicaid too, as you said, it's a state plan. It's for any age as long as they make less than $1,400 a month.
Individual in the family, I'd have to get those numbers. I'm not exactly
Okay.
100% sure, but
But
yes,
that's a state.
that's state.
Yeah, and how if I am business owner or employee, and I'm very close, I'm 60, 59, 58, how I can educate myself in order to find out what is the best way to do, what plan to choose, what would be the best, how we can do it.
Yeah, that's a great question, and one of the things I have so many people that come and they used to when I was on the insurance side, and say we need more people educating. UNLV actually does have a class now.
Oh, really?
Medicare. They
That's
actually
awesome.
do, and I would strongly recommend is YouTube. Have some great people. I have my YouTubes also out there that will teach you what they are. But call a broker. Let me tell you the difference. There's a difference.
Yeah, what's a
between an
broker
agent
versus an agent?
and a broker? An agent works for the company that they represent.
Correct.
A broker works for you. Mm-hmm. They're the ones that can tell you about all the different
They rep
companies.
multiple lines, multiple companies of
Yes.
everything. Okay.
And when you talk to a broker, say, do you represent everyone? Yes, we do. Okay, name them. They'll name them. They will go out and they will find the best plan for you. If you call and you speak to an agent, they're going to sell you whoever they represent. Yes.
And nice. And Andy, can people reach out to you and contact you directly if they have any questions regarding
Yes,
this?
I have the numbers right there. Then
Okay.
if I had my glasses, I'd be able to tell you what the numbers are.
Okay. Do you have a way to contact?
Andy.
How do they call you? How about that? Can they call your cell phone?
Yes, and it would be 725-247-0933.
Perfect.
Okay.
Thank
Vitamin
you.
B.
Right. Glasses could be covered for you. I'm just saying,
Yeah, that's true. That's true.
We love readers. I got readers too. I wouldn't have attempted to read them. I'm like, you could hold this across the room.
And then you'll probably see it.
yeah, I'll be good with that. But just
Welcome
in
to the club.
exactly. Just in parting, it's been great having you on. Great going through all this stuff. Any final just word of advice for especially business owners? What should you do for your people to make sure they're taken care of properly?
Plan. Make sure that you go over what their benefits are going to be. If they're getting to that retirement age, and don't wait till you're 65 to look. Start planning early. and start looking and educating them, knowing that you can save a lot of money with people going on Medicare instead of keeping them on the insurance in your business.
One question, Andy. Your doctors are bilingual? Because we
do have bilingual
population.
Nice.
We do have
Spanish.
bilinguals. We do have bilinguals at Archwell. Yes.
Perfect.
Okay, excellent. Great questions, you guys, and great discussion. Really nice to meet you, Andy, and glad you're here, and glad you gave us some good knowledge here today. So that was good. So
Yeah.
All right,
We
thank you,
learn
Bob.
a lot.
yeah,
We learn a
absolutely.
lot.
Thank you.
Well, thanks once again for joining us for the BizLife Podcast. Go do something great in your business today. Thank you.